You walk half a block, your legs get heavy or crampy, and you have to stop. So the question is that coming from your spine or is it poor circulation? That difference matters because one of these is usually a spine problem, the other can be a warning sign for a heart attack and stroke risk. So today, I'm going to show you the patterns that help separate lumbar spinal stenosis from vascular claudication, including the everyday grocery store clue that often points towards the spine. And I'll also tell you why even spine surgeons can get this wrong if they only look at the lumbar MRI. I'm Dr. Omar Ramos, I'm a spine surgeon, and spinal stenosis is one of the most common reasons people lose walking distance as they get older. But today I'm going to spend real time on the version that is not mine to fix, because that's one you cannot afford to miss. The medical word here is claudication. Claudication means leg pain, heaviness, fatigue, or cramping that comes on with walking and improves when you stop or change position. There are two major types we're talking about today. Neurogenic claudication comes from the spine. That usually happens when the spinal canal narrows. The nerves that travel down into your legs get crowded, especially when you stand upright or walk. Vascular claudication comes from circulation. That happens when the arteries feeding the leg muscles are narrowed. When the muscles work, they need more blood. If they cannot get enough, they start to hurt. Same complaint, my legs hurt when I walk, but completely different systems. And from the patient perspective, they can feel surprisingly similar. So the key is not just what it feels like, the key is what makes it start and what makes it stop. The cleanest clue is this: vascular pain answers to rest. Spine pain answers to posture. Let me explain. With vascular claudication, the muscle is asking for blood. So when you stop walking, the muscle stops demanding as much blood. The pain often settles within a few minutes, even if you just stand there. You do not necessarily have to sit down. You do not necessarily have to bend forward. You stop moving, the muscle demand drops, and the pain eases. That points more towards circulation being the problem. With neurogenic claudication from spinal stenosis, the pattern is different. The issue is not just that your legs are working. The issue is that standing upright and walking can narrow the space around the nerves. So these patients often say, standing still doesn't really help me, but if I sit down or bend forward or lean on something, it starts to ease. That points more towards the spine. So the practical question is not simply, does it get better when I stop? The better question is, does rest fix it? Or does posture fix it? Vascular pain answers to rest, spine pain answers to posture. That one distinction is one of the most useful things you can bring to your doctor. Now, there is the classic everyday version of this called the shopping cart sign. People with spinal stenosis often notice they can walk much farther at the grocery store than they can across an open parking lot. Why is that? Because when you lean over a shopping cart, you bend your spine forward. That forward bend position can open the space around the nerves. So the cart is doing something similar to sitting down. It is putting the spine in a position that gives the nerves more room. If you have quietly noticed, I do fine with a cart, but I struggle with that one, that points more towards spinal stenosis. It's not proof, again, but it is a strong clue. Circulation problems generally do not improve just because you found something to lean on. They improve when the muscle gets to rest. Now, pain quality can also help, but is softer than posture. Spine-related claudication often comes with heaviness, numbness, tingling, pins and needles, or a rubbery feeling in the legs. Some patients say their legs feel like they may not hold them up, like they may give out. It may involve the buttocks, thighs, calves, or both legs. Vascular claudication is more often described as a tight, hard, cramping ache. Classically, it is in the calf because the calf muscle is downstream of many common artery blockages, but it can also be in the thigh or buttock if the narrowing is higher up. So the location helps. The pain quality also helps. But neither of those things prove the diagnosis. Plenty of people do not read the textbook. That is why posture and recovery pattern matter so much. Now, let's talk about how we actually separate this in clinic. I'm going to explain this so you know what to expect, not so that you can try to diagnose yourself at home. One useful clue is comparing the bike to the treadmill. Someone with spinal stenosis may tolerate a stationary bike better than walking on a treadmill. And why is that? Because on the bike, you're bent forward. That flexed posture can open the space around the nerves. But when you put that same person on a treadmill, standing upright, the leg symptoms may come on much faster. With vascular claudication, the bike does not reliably spare you in the same way because the issue is the muscles' demand for blood. If the leg muscles are working and they cannot get enough blood, symptoms are still gonna show up, regardless if it's the bike or the treadmill. We also check the pulses in the feet and ankles. Strong pulses do not completely rule out a circulation problem, but weak pulses raise that suspicion. And there is a simple screening test called an ankle brachial index, or ABI. That basically compares the blood pressure of your ankle to the blood pressure in your arm. It is one of the most common ways to screen for peripheral arterial disease. Again, the point is not that one clue gives you the answer. The point is that your story, your exam, and the right tests have to be put together, because guessing wrong here has real consequences. And now I want to explain why this is easy to get wrong. These two problems do not politely take turns. They can exist in the same person at the same time. The same age group that develops spinal stenosis is also the age group where artery disease becomes more common. And the risk factors can also overlap: age, smoking, diabetes, high blood pressure, high cholesterol. So it is very possible for someone to have a narrow spinal canal and narrowed arteries feeding the legs, both at once. When that happens, the symptoms can become blended. The posture clue gets muddy, the pain quality gets mixed. The neat checklist stops being neat. And this is where imaging can fool people. A patient can have severe spinal stenosis on an MRI, clear as day. And yes, that stenosis may be real, but an MRI of your spine only shows your spine. It does not show whether the arteries in your legs are delivering enough blood. So if everyone is focusing only on the spine MRI, they may miss the circulation problem. That is how someone can have spine surgery. The MRI findings was real. The operation may have technically fixed the narrowing, but the patient still has walking pain because circulation was part of the problem all along. That does not mean the MRI was fake. It does not automatically mean the surgery was botched. It means the picture did not tell the whole story. A picture of one system cannot rule out a problem in another system. That is why symptoms and imaging have to be matched with a careful exam. And that's why you should not settle this from a video or from a scan alone. Now, here is the part I really do not want people to miss. When leg pain with walking comes from the arteries, the condition is called peripheral arterial disease, or PAD. And PAD is not just a leg problem. The same process that narrows arteries in the legs can also be narrowing arteries around the heart and brain. That's called atherosclerosis. That means vascular claudication can be a warning sign of higher heart attack and stroke risk. So if you have calf cramping that comes on at a predictable walking distance, improves when you simply stop, and does not really change when you bend forward, you should get your circulation checked promptly. Not because you need to panic, but because you should not assume it's just your back. And if you have foot wounds that are not healing, pain in the foot at rest, a cold or discolored foot, or sudden severe leg pain, that is not a YouTube problem. That needs urgent medical attention. So let's bring this together. If bending forward, sitting down, or leaning on a shopping cart helps, spinal stenosis moves higher on the list. If simply stopping helps, especially with predictable calf cramping, circulation moves higher up on the list. If there is numbness, tingling, heaviness, or rubbery legs, that leans towards the spine. If there is a tight, hard, cramping muscle ache, especially in the calf, that leans towards circulation. But none of these clues are perfect, because both conditions can exist together. So can I tell you which one you have from a video? No. And anyone who does is actually just guessing. The real answer comes from putting your story, your exam, your pulses, sometimes that ABI test, and imaging when appropriate side by side. And even then, what we land on is, again, a differential, a best explanation ranked against the others, and held open to being wrong if your body tells us something different. The bottom line is this: leg pain with walking is not automatically spinal stenosis, and it's not automatically circulation. But the distinction matters, because spinal stenosis can limit your function and quality of life, and vascular claudication can be a sign of a much bigger cardiovascular problem. So do not ignore the pattern. Pay attention to what brings it on, pay attention to what makes it better, and bring that information to someone who can examine you properly. If the spine side of this is sounding familiar, I have a full video on lumbar spinal stenosis and the shopping cart sign. And the rest of this series breaks down other common look-alike: hip versus back, sciatica versus piriformis, and SI joint pain. I'm Omar Ramos, a fellowship-trained spine surgeon at Twin Cities Spine Center in Minneapolis, Minnesota. I'll see you there.